It would take all day to talk about telemedicine, but I can talk about my aspect of it, which is using the power of the internet and computer-aided communication to treat patients at long distance. My cancer patients, once they have their pumps in, need to be refilled. And for many of them, especially if they live a long way, we've had patients as far away as Uvalde, Texas. One of my patients actually took a trip to the coast on distances, in that case, of thousands of miles. In the past, they would never be able to do that. They would have to come to the office and get their pumps refilled. And that's a burden for them and for their family members who have to bring them. But now we have a service where nurses can go to their house and refill their pumps. One would think that I would lose contact with them, but what we can do is they can set up a laptop computer and sometimes even a smartphone, and I can actually see my patients, speak to them in real time if they have concerns about their pump site, swelling of their ankles, even disability. I actually had one nurse put my patient through a neurological examination on the screen while I watched. With that, I can diagnose problems from a distance. This gives people a much better quality of life. It saves time, money, expense, and for many of them, pain due to the long travel they would have to make to see me. Telemedicine extends our reach. I guess it could be around the world, but for the most part, we've kept it here in the United States. You know, this man who went to the coast, he couldn't travel because if I gave him a handwritten prescription for his pain medicine, he can't take a prescription from Texas and get it filled in Florida. But I can send an order to a nurse in Florida and she can go fill his pump. And even change the medicine, which is what we did, to get him back on the road. With telemedicine, you no longer live too far away from me to be your doctor. I can manage problems, from a distance with this service. And so people who thought that it was too far to come to San Antonio can come once, we can get things set up, arrange their care, and manage them as if we were right around the corner.